This is Jerry Hesch with our case titled Lateral Foot Pain in a Marathoner Who Quit Running 2.5 years, Failed Prior Diagnosis and Treatment. This is part 3, and this is evaluation and treatment at the Hesch Institute. This is day 3, and we did a couple of interesting things. We had him stand on a bilateral digital scale that I have back there. Cannot even locate the manufacturer. It was made quite a long time ago. But it's very nice. You can, I'm forgetting the word, where you zero it out. You get it to both scales to zero calibrate is the word I'm looking for. And on day 1, after we finished filming, we checked it out. And he was tending to be about 20 pounds more, between 20 and 50 pounds more on the left side. Now that was congruent with a left pelvic side glide. Go ahead and line your back. Now, if you recall that most of his pain was in the right foot and ankle, although he had some in the left side in a fairly symmetrical pattern. Well, what we found on day 1, if you recall, is that he had restricted internal rotation of the right hip. And today it remains improved at 30 degrees with a normative end feel. Now that was part of the pattern, and also restricted left to right pelvic side glide. And I'm not sure that we captured that earlier or not, but when I push his pelvis left to right, I should get to an end point where I take up the slack. At that point, I should be able to impart a little bit additional movement. And if I did it correctly, there'll be a final recoil. That was absent. And another finding that we did capture on film was that his shoulder girdle, his AC joint on the right, was quite restricted. And we treated that. We're going to teach him how to maintain that today, and that's much freer. I'm springing at an angle at a 45-degree posterolateral. So I thought that might be what was driving the bus for him. And in truth, we really don't know. I think you recall that both ankles and subtalar joints were very restricted. And what we came to learn about his structure is that there's one part of his body that's very stiff on both sides with limited motion. That happens to be the feet and ankles. His knees are much freer in general than are his feet and ankles. The ability to lift his foot up improved somewhat. He was at 0 degrees. He's now at plus 10 degrees. The subtalar joint mobility was completely restricted, and we were able to open up some movement there, but not very much. Not a lot, and that's just his norm. Okay? We'll take a look at him walking. But the very surprising thing that may really be a big driver in his presentation is the lack of mobility throughout the right side of his pelvis. Regardless of body position, regardless of angle in which I try to impart movement through the pelvis, on the right side it feels like a block of granite. I cannot induce passive force through that structure. I speculate that his right sacroiliac joint is fused. On the left side, I can take up the slack in a rotational manner, and I can spring, and you can see that recoil. And using a very similar force on the right, there's just no give whatsoever. And regardless of what technique I've used to try to enhance mobility there, it just is not improving. Now, he has had MRI and x-rays to his lumbar spine, and it did not reveal any significant pathology. So it's an interesting clinical finding. What I would like to do is have him walk now, and we'll film his feet while he walks. Let me go ahead of you, please. And if you want to make any comments about your response to therapy, I'd appreciate it. So come on, yeah, go ahead and strike a straight line just like we did yesterday, or 2 days ago rather.
The one thing I've noticed in the treatment is when Jerry loosened up my hips more than anything.
What was the response to that?
The additional movement, it seemed a little floaty at first because they had been so restricted for so long that it actually felt strange at first. So, clearly I had adapted and didn't know how bad it had gotten. And now that my ankles are a little looser, I don't feel as if I'm walking on the outer lateral edge of my feet anymore.
Very good.
So I actually feel pronation again.
Nice.
Whereas when I came in, I couldn't feel like I was engaging the big toe of my feet at all. And I feel that now.
Very good. And you did a fair amount of walking last night on the strip?
I did a fair amount of walking last night. For anyone that's thinking about coming out, so much to do in addition to coming out to the Hesch Institute. We did a fair amount of walking on the strip last night, and my feet got fatigued toward the end of it, but it was after several miles. So I'm taking that away as a huge positive.
Nice. Well, I think this is a good summary. Pleased with the gains that we made. It was interesting to find the lack of mobility through the right side of the pelvis. And but I think we can keep everything else that we worked on in terms of the shoulder and the pelvic side glide and the internal rotation of the hip and the ankle and subtalar mobility. So that was part 3. Thanks very much.